this is the kidney, top of the kidney, this is the gland, this is called suprarenal gland. Supra means up and renal means the kidney. So suprarenal gland. So the gland top of the kidney, this is called adrenal gland. Other name is called adrenal, suprarenal or adrenal. So right adrenal, left adrenal. If we go inside, I mean the structure or histology of adrenal gland, we have to get two zone. One is called cortex, outer layer, and inner layer is called medulla. Outer layer is called cortex, inner layer is called medulla, right? Outer layer, this layer I'm talking about, they contain the three layers again. The cortex, again they have the three layers, and this cortex secrete the hormone, this called glucocorticoid, mineralocorticoid, and androgen. Androgen is called the sex hormone or sex steroid hormone. So adrenal cortex help us to produce steroid hormone. Also, they produce the sex hormone. Glucocorticoid and mineralocorticoid maintain the electrolyte balance in our body. Also, they maintain to the water balance in the body. And sex hormone or androgen definitely very important to produce testosterone and estrogen or estradiol. So sex hormone is important to distinguish between man and female. So really important, right? This small gland has a big role. Here the inside this gland is called medulla, and medulla secrete two important hormone. This is called epinephrine and norepinephrine, or adrenaline or non-adrenaline, right? So adrenal gland, this gland, I said the cortex basically secrete glucocorticoid, sex hormone or androgen, and mineralocorticoid. So adrenal gland help to make adrenal hormone or cortisol, and this is important to help the body to deal with stress. I said this hormone basically adrenal hormone, when the too little, means if the adrenal cortex does not produce enough glucocorticoid, mineralocorticoid or sex hormone, this is called addiction disease. Too little produce of their hormone, or addiction disease is too little hormone produced by adrenal cortex. Same way, or on the other hand, when adrenal cortex produce too much glucocorticoid or mineralocorticoid or androgen, this is Cushing disease. So addiction disease or Cushing disease, this is the disease of adrenal gland. More accurately, this is the disease of adrenal cortex. Adrenal cortex, I said, if adrenal cortex produce too much hormone, this is Cushing syndrome. If adrenal cortex produce too little hormone, this is addiction disease. And also I said the hormones secreted by adrenal cortex I mean steroid hormone or adrenaline, they help to deal with the stress, right? So in a shortly, I'm just going to read these pages. So it might be help to us to understand what are the normal function of adrenal hormone, right? I said the adrenal hormones secrete the cortisol, they secrete the sex hormone, they secrete the androgen or aldosterone. So cortex, basically cortex is the steroid hormone like mineralocorticoid or glucocorticoid. They control, help the body to adapt in the physical and emotional stress. So adrenal cortex hormone is help to the body to deal with stress. Very important hormone, right? And same time, I said when adrenal cortex does not produce enough or very little amount, the disease is called Addison disease. On same way, if this cortex is too much, this is called the Cushing disease. This is called the Cushing disease. So here a little bit, stress hormone. Another hormone secreted by this gland, especially renal, is aldosterone. Aldosterone, this is a hormone act on the kidney to help the regulate the excretion of salt and maintain the blood pressure. So this adrenal gland secreted the aldosterone, and aldosterone is important to maintain the body fluid, electrolyte, and also important for blood pressure regulation. And another hormone secreted by adrenal gland is called androgen or sex hormone. This adrenal androgen promote the development of secondary man sexual characteristics, right? And what about the other gland, which is the secreted by here? This is called adrenal medulla. Adrenal medulla secrete epinephrine and norepinephrine, right? Secrete epinephrine and norepinephrine. And the function of this epinephrine and norepinephrine, this hormone is triggered the fight and fly, right? So I said one example, suppose you pass the NCLEX board, right? And you found the result today evening and you are enjoying your time. You went to the club, you little bit drunk, right? And some good food. When you finish everything, just imagine the scenario. You walking in the street, suddenly you saw a big dog on behind of you. So when you see the big dog and there nobody can help you, even you do not have car, then what you do? You should run. When you should run, definitely your muscle is work too much, your heart is palpate too much, right? Heartbeat is increased. So it is the emergency situation or condition. So in epinephrine or adrenal hormone response or work when body need any kind of emergency situation. This is called fight or fly, right? So you are fighting with the condition when big dog is running on you, and also your muscle is to work like you are flying like a jet plane, right? So this is the fight and flight response, and they increase the heart rate and also they increase the blood flow to the muscle. So this is the normal function of adrenal hormone in the body. So